So we're going to get started. I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakanna. I am also one of the co-founders of this amazing company. And this evening, we're going to be talking about losing weight. We're going to be talking about losing weight, getting more fit, having more days where we're energetic and we're happy and we're sleeping well and we're doing all the things that we should be doing to improve our overall wellness. We're going to also talk about how does CBD fit into losing weight. But first, I'm going to bring up my colleague and one of our medical advisory boards here at Wakanna. We're going to bring up Dr. Crowford. Let me tell you a little bit about this amazing woman. She is a family practitioner, a family physician. She's a board certified family medicine physician. She attended University of Illinois Champaign for her undergrad. She went on to pursue her medical degree at the University of Illinois at Chicago. She completed her residency in family practice at Rush, and then she did a sports medicine fellowship at McNeil Rush Presbyterian Hospital. She is a mom. She's a wife first. I think she's a mom of 5 girls, if I'm not mistaken. A lot of women in that house, in that household. And she is truly, truly my Greek sister. She's a Delta. She's my Greek sister. I met Dr. Crowford when we were both challenged. She was challenged with some issues with her blood pressure. I was over 211 pounds. And so we met at a gym where we have truly, truly bonded and we've grown together. And now she's a part of Wakanna, and so excited to introduce to you Dr. Crowford. Are you out there?
Yes, I am here. Thank you.
Wonderful.
Thank you. So I appreciate you too as well, our close friendship that we've had, and hopefully this dog doesn't bark.
I know.
But like I said, thank you again. You have been an inspiration to me as well as Chief Medical Officer, and just being able to share all the knowledge that you've had and the leadership that you've given. And I'm just so excited. When I grow up, I want to be like you too as well.
Oh gosh.
So I'm going to be a little bit brief as far as weight loss and obesity and overweight and unhealthy weight are different terms that you hear. And we can talk all day about weight, but we're going to just kind of focus a little bit on what you should be concerned about and how you can make a change. So basically, you want to know the definition of obesity, and that's the BMI, the body mass index. And it's a formula that has been used for several years. And I know people of color and Asian people do have an issue with that number, but I just want to say you use that as a guide, but we kind of know if we have unhealthy weight or not. It's just used as an index. And so if your provider tells you that you're overweight, unhealthy weight, obesity, and BMI, and actually you can do that calculation just by Googling it yourself with your height and weight. If you're over 25, that's the number where we've found that you have an increased risk of several other conditions that can be, prevented. And so the reason why we're looking at the weight is because research shows that obesity increases the risk of having diabetes, it elevates your blood pressure and hypertension. You have an increased risk of having heart disease, increased risk of having stroke, increased risk of having hyperlipidemia, hypercholesterol. And then there's an increased risk of stress and anxiety, and all the things that come with stress and anxiety and low self-esteem. There's also increased risk of being immobile, functionally disabled, basically, having increased risk of arthritis. And so the other conditions are sleep problems, sleep apnea. Sleep apnea is where your neck and neck muscles and tissue basically block your airway and blocks the airway and then oxygen. And then if you don't get oxygen to your brain, then that causes several issues that increase hypertension and diabetes and depression as well. So, and I'm sure there's other things that I'm probably missing, but those are a lot to be concerned about when you're looking at the obesity. So that's why we want to kind of recognize that, because all those things that I listed can be prevented. Okay. And so you say, well, how can I do that? Well, first, you want to look at two major things: what you're putting inside your body, and that basically is the same thing like we treat as a car. If you want your car to run well, you got to put the right things in your car. So they say there's an 80-20 rule where 80% of weight loss is kind of what you're eating. And it's kind of true, because I've had patients who lost weight who have had knee surgeries and things of that nature, but they've been able to control their eating, even though if they can't exercise, but they can control their eating and lose weight. And then the other portion, like I said, is the exercise. So when you're looking at exercise, it's recommended to have at least 150 minutes of some form of exercise. And I know people get kind of, weary of the E word, exercise, but it's just activity. It's just moving around. You can do something fun. You can walk in your house with this weather. You can get a jump rope. You can pretend to have a jump rope. Exercise is free, really.
You could do a hula hoop. I love hula hoop.
Right, the hula hoop, it could be fun. You can, run. Well, you don't have to run around, but just kind of play around. Even gardening is a form of moving, moving around. So you want to get something in that's going to start increasing your heart rate, so you can burn the calories that you're consuming to eat. So you can split that up into 30 minutes 5 times a week. You can start slow, 10 minutes a day, until you can work up, a goal of 30 minutes a day. And you can even do 50 minutes an hour 3 times a day. Whatever it is, just try as a goal to get to that 150 minutes a week. But you also want to reserve 2 days of some sort of building muscles, because yes, once we lose the weight, we still need to build that muscle back, because of all that, the muscle and the tissue, you need to build that muscle back. And so you can use weights, but once again, you can get gallons of water or cans, and even resistant bands can help out. So remember, with the exercise, whatever you decide to do something, move around, but also you want to get that muscle built into as well. We're not talking about being, the Incredible Hulk, but you also want to get the muscle build up to as well. And so you also want to get sleep, the adequate amount of sleep. On average, the adult is that gets adequate sleep is 7 to 9 hours a day. And so when you get that sleep, you decrease your risk of the obesity. You want to get enough water in your system. We're like 80% of water in our body. So the best thing to replenish is just plain water. So you can avoid all those sugary beverages and things of nature. But, and the rule is that you can remember is like half your weight ounces. So if you're 200 pounds and then you want to drink at least 100, ounces a day, and that's typically a rule that you can do. If you're doing more moving around, you're going to drink a little bit more water. If you're out in the heat, you're going to, drink a little bit more water, but that's kind of, like a rule based upon, your body habits. And so in addition to sleep, you want to get the right food in you. So if one of my resources that I want to mention is myplate.gov. So myplate.gov, you can go there, and it's no longer the food pyramid, it's the actual plate. And so you're looking at portion size as well as what's on that plate. So gone are the days of getting that dinner plate. Let's focus on the small portion size of the salad plate. And then it's divided into 4 portions. There's the grain, fruit, vegetables, and protein. So with the protein, recommend no more than the size of a deck of cards. Most people know what that is. I think 4 ounces of lean protein. If you don't eat meat, then you're just going to get more plant-based protein in your diet. For instance, eggplant, mushrooms, but that is, protein, and protein helps build muscle. And then you want to look at half that plate too. Well, you have the vegetables and the fruit. And so half that is the plate. If you don't want to do a lot of starches, then I recommend adding more colorful leafy, vegetables to your plate too as well. And you want to be cautious with actually getting a lot of fruit in your diet if you're a diabetic, so you want to mix up that fruit and vegetables. But I also want you to go to the American Diabetes Association, and they have a good list of non-starchy vegetables. So your goal would be to get at least 2 or 3 servings per meal. So that means breakfast, lunch, and dinner. I'm sure if I ask people to put in the chat, what do they normally eat for breakfast? I'm going to hear a lot of grains and starches, and probably not a lot of vegetables. So one of the things that, I learned in my weight loss journey is, not getting all that bread and toast and pancakes, but start adding in eggs as protein with some scrambled eggs, and put a little broccoli or spinach and tomatoes and mushrooms, onions, to get those vegetable servings in for breakfast. And so you want to, as I said, increase your vegetables to like 2 or 3 servings each meal. And then you do have some people that are doing the intermittent fasting, and that's fine. If you're diabetic, that's something that you want to, discuss with your provider. But when you're doing that, you also want to kind of look at what you're eating, because it's not meant to overeat when it comes time to, break that fast. So that the intermittent fast sometimes, helps out with people. And then in addition to, like I said, the sleep, the water, what you're eating, there is a book, and let me get the name that I recently will listen through the audio. It's called Wheat, W-H-E-A-T, Belly, Total Health, by William Davis, MD. He's an MD. So that's Wheat, Belly, B-E-L-L-Y, Total Health. And it was an eye opener for me. Somebody, I can see that they put in oatmeal. And at the beginning of my weight loss challenge, I thought I was good. I'm the doctor, the heart doctors tell you to eat, oatmeal. But for some people, that oatmeal as a grain can cause inflammation. And that can cause a lot of different mechanisms too as well. So I would venture to say, read that book, make your decision yourself. But one of the things my coach would said, and it was true for me, is bread makes you spread.
Yes.
So please kind of read that and kind of make your own, but it'll be very, eye-opening as far as, that's why I said sometimes the grain, you may want to just eat more non-starchy vegetables. And so in addition, when you're looking at a goal for weight loss, on average, it's 1 to 2 pounds a week of once you start getting that exercise in, and once you start, changing your diet. So a good slow weight loss, because you didn't gain weight overnight, and it's not going to happen overnight. There are some motivated people that can lose 60, 100 pounds in 3 to 6 months, but on average, to keep that off, you want to look at, around 1 to 2 pounds a week of weight loss, with the goal of maybe 5 to 10% of weight loss. So if you're 200 pounds, maybe 5% weight loss, and your goal is to get 10 pounds. So, within maybe a month and a half, you might be able to do that, because what we don't want you to do is be frustrated and bouncing back. So I'm not sure how much of time I have, and looking at my notes here.
Well, you brought up a very good point, because quinoa is another grain that I found out that causes a lot of inflammation. And I love quinoa, but every time I eat quinoa, that right knee that has a little Arthur in it
Yes.
starts to show its ugly head. So what is the author of that book?
William Davis. He's a physician who has some challenges, and he has a couple of series of books, but that was the one I had, William Davis.
Okay, thank you so much. Because all of these things are really important when you're really looking to not only improve your weight, but improve the inflammation in your body. So you want to stay away from foods that are inflammatory, that can, one, make the obesity harder and more difficult to lose weight. And two, if you have chronic inflammatory issues like arthritis, it could make it worse. So that's really good information, Dr. Crowford.
Yes.
Thank you for that.
Mm-hmm.
Wonderful. What's the name of the book addressing inflammation?
So the one that I was mentioning is called WHEAT, WHEAT, Belly Total Health, William Davis, MD, and I'll write that in the chat if somebody missed it.
I'm going to put it again.
Okay.
Total health. Okay. So thank you so much. A lot of people, you can put your questions in the chat, because we're going to move on to CBD. But a lot of people, want to do the fast route. They want to do the paleo diet, what else is out there? The keto diet, the lemonade and cayenne pepper diet. But what I always learn in my weight loss journey is that sustainable? I mean, are you going to eat like that for the rest of your life? The answer is probably no. So getting a diet that, again, has what we need to build lean muscle, the protein, the veggies, the right amount of proper grains, looking at fruit. Don't overdo it with fruit. Yes, you can eat fruit, but you don't want to sit down and eat pineapples and watermelon. You don't want to eat those fruits that have a high glycemic or high sugar content. So making your diet as easy as possible, and making your diet something that you can sustain for the rest of your life, is the best way to go. Is the best way to go. And again, protein is your friend, right? Whenever you get hungry, try to reach for protein and not carbs. And that's what our problem is, right? We always reach for the carbs, we reach for the food that makes us feel good, and not the foods that are really going to sustain the cellular makeup in our body, give us energy, increase the metabolism, and really help us lose weight. So if there's any questions, you can start putting those in the chat, because I know, Dr. Crowford, you have to leave soon. We sell many, many products for Arthur. We're going to get into that. So thank you so much, Dr. Crowford. That was awesome.
Thank you. Thank you.
Very great information. We all know what to do, but it is so hard to do it, right? With everything that's going on, we all on the line know about comfort food and things that make us feel good, but that's not what's going to be the healthiest for us. So we're going to move on, and we're really going to talk about how CBD can be one of the tools that we can use for weight loss. And this is a really fast fact that you should know, that CBD is thought to melt away fat in the body by breaking down the fat and helping eliminate it from the body as waste. Sounds good, right? Sounds like we all want a bottle of that CBD. So let's look at some of the most popular reasons people use CBD. Right now, it's for anxiety, insomnia, inflammation, depression, tension, headaches, and of course, pain. Pain is right up there as the number one popular reasons that folks use CBD. But we're going to talk about weight loss tonight. How does CBD assist for weight loss? Well, we're going to talk about how it can aid in suppressing your appetite, how it can aid in fat browning. We're going to talk about what that is, how it can aid in improving your metabolism, and how CBD may aid in reducing the risk of metabolic disorders. So why is it that we eat so much? Well, I can tell you why I eat so much sometimes. It's because I am sleep deprived. I will work 24, 48, 72. I don't know. It's not healthy, but it's just something that the healthcare profession has instituted, and it's a very unhealthy thing. You know, when I look at a lot of my attending physicians that train me, many of them have dementia or they have Parkinson's. They have something going on, and I swear it's because of our sleep deprivation. When we don't get enough sleep, there are hormones in our body that Dr. Crowford alluded to. There's a hormone that makes us feel hungry, ghrelin, and there's a hormone that makes us feel full. It's called leptin. And when we are sleep deprived, we have that hormone working in overdrive that makes us feel hungry, right? There is an imbalance, is not a homeostasis of those hormones, that many times you'll see that when you are hungry, it's really not that you're hungry, it's because you're sleepy. Or many times you may think you're hungry, but you're really dehydrated. You're really thirsty. So all of these bad habits cause us to increase our food consumption, being bored, even having a nutritional deficiency like an anemia. Social eating and events, well, that's not really an issue anymore because of the global pandemic, but definitely a desire to clean our plate, mental fogginess, and of course, the emotional eating. We get angry, we eat. We're happy, we eat. We get a promotion, we eat. We get fired, we eat. You know, every single emotion that occurs, we're eating. So that is one of the reasons that we have to really look at CBD as a tool that we can use to assist with our weight loss. So let's look at the cannabis plant, because many of you on the line may be new to CBD and you don't understand what I'm saying or talking about. So let's look at the cannabis plant. And the cannabis plant has over 100 plus compounds that it makes, over 100 cannabinoids. But the two most common ones are THC, that's a part of the plant, or the compound that gets you high. And then there's CBD, which is non-psychoactive. It doesn't get you high at all. And both of these compounds can come from marijuana and hemp. But the difference between marijuana and hemp is that marijuana, because it has high levels of THC, it gets you high. It gives you that euphoria. It gives you the munchies. That's why, you know, many people think, well, how will CBD help me lose weight if we know that cannabis makes you get the munchies? Well, that's on the marijuana side. That's when you have high levels of THC with that product make you eat more. But it's really CBD that has a negative interaction. It blocks that interaction that THC has with the brain to stimulate your appetite. Well, CBD blocks that pathway. So it doesn't cause a stimulation in your appetite, it causes a suppression. So it's the hemp part of the cannabis plant that gives you the health benefits without the high, that gives you the ability to lose weight without the munchies. It is the part of the plant that contains very trace amounts of THC and high levels of CBD. So CBD is an abbreviation for cannabidiol, and it has a long list, as you can see here, maybe a little blurry. Dr. Rita's got to go and get her glasses. I've been saying that for about a year. But CBD has a long list of medicinal benefits. You know, CBD is a great antibacterial. It helps to promote bone growth. It helps to reduce blood sugar levels. And that's really important when we're speaking about diabetics looking for an alternative to help them lose weight. It also helps to reduce inflammation. And when we talk about chronic illnesses, when we talk about obesity, when we talk about hypertension, we talk about heart disease, when we talk about arthritis, all of those chronic illnesses that we know many people have, it's because there's an increase of inflammation in our body. So CBD reduces inflammation. CBD helps to reduce pain. It helps to reduce anxiety. I mean, it's a vicious circle, right? I'm anxious, I'm mad because I gained 9 pounds. Yes, Dr. Rita gained 9 pounds, fooling around with all this COVID stuff, right? And working so many hours and being sleep deprived. I know it's an excuse, but we just learned that sleep deprivation can cause an imbalance in those hormones. But CBD has many, many properties that will assist those who are dealing with other symptoms when it comes to being able to lose weight. So helping you sleep, helping to reduce anxiety, helping to reduce pain, because we're working out every day now. We're trying to get into the groove. We need something to help address the pain. It also is a vasorelaxant. So when we talk about hypertension, we talk about conditions like erectile dysfunction that has a blood flow issue. CBD can come in and help improve blood flow. But what's even more important, there's other compounds like CBG and CBC and Delta 8 THC and Delta 9 THC. All of these other cannabinoids that the plant produces are important on a cellular level to improve a lot of the conditions and symptoms that we see in people who are overweight. So how does CBD work? Well, CBD works by the human endocannabinoid system. We all have this system that's made up of receptors, and these receptors, when we talk about weight gain, right, and weight loss, these receptors are important receptors in the brain, in the central nervous system. Why? Those receptors, those CB1 receptors, modulate and regulate appetite. So that's why CBD and other cannabinoids are very instrumental in helping us lose weight, because they're targeting specific receptors in the brain and the central nervous system that modulate and regulate our appetite. And again, THC, that's a part of the plant or the compound that gets us high. Yes, it gives us the munchies because it stimulates those receptors. But CBD comes in and blocks that appetite stimulation pathway in the brain. So this is how CBD works. And these are other receptors and other organs throughout our entire body. So the lung, the liver, the stomach, the reproductive tract, the bones, all of these receptors in the endocannabinoid system are found to put our body in homeostasis, to put our body in balance, to reduce the inflammation. So it's real science behind how CBD works. Again, this is a study that shows that CBD has an effect on our endocannabinoid system by responding, by binding to receptors, CB1 and CB2 receptors. Again, when it comes to appetite suppression, it is not what you think. When people think about cannabis or cannabis-derived products, they think about stimulating the appetite. They think about those people who are high and get the munchies. However, CBD does not appear to have the same effect like THC. In fact, there's a study that shows that CBD not only helps suppress the appetite, but also deactivates the appetite stimulation center in the brain. Now let's talk about fat. Now, fat is a really important thing to understand because there's two types of fat. There's white fat and there's brown fat. Now, it's the white fat that's the bad fat. That's the fat that is around our organs. That's the fat that when you see the men with the beer bellies, right? I hate seeing that because that is so unhealthy, even for women. If you have fat around your abdomen, that means that it's causing your heart to work harder. Why? Because that white fat is insulating organs like your heart, your liver, your lungs. So what CBD does, it helps to convert that white fat into brown fat. And it's the brown fat that burns calories. It's the brown fat that we see more in healthy people. It's the brown fat that helps to make your metabolism more efficient. So CBD truly has a role in converting white fat into brown fat. So it's a little nugget that many of you may not know. Now, how does CBD reduce the risk of metabolic disorders? Well, we talked about in that chart some of the medicinal benefits of CBD, right? We talked about how CBD is a vasorelaxant, so it helps to dilate vessels in those who have hypertension or erectile dysfunction. It helps to stabilize blood sugar levels, so it helps those type 1 and even type 2 diabetics that are insulin resistant. And it also works in improving cholesterol. And it does that again through these CB1 receptors that are found in fat tissue. It helps to not only reduce inflammation in different organs and glands, but it also helps to reduce total cholesterol. There was a study where they found that using CBD in these rats reduced their total cholesterol by 25%. And again, it has everything to do with the fact that CBD is an anti-inflammatory, CBD is an antioxidant, and so it's able to improve blood sugar levels and to improve the health of our liver. So when we look at CBD and weight loss, we can put it all together. You know, CBD helps to reduce the appetite because it's not stimulating the appetite. It's working on those CB1 receptors to block the stimulation part and to help to prevent overeating by suppressing the appetite. It also helps your metabolism. How? Because it turns that white fat, that bad fat, into good fat, that brown fat, that fat that's going to help speed up your metabolism, burn fat, and give you energy. And CBD also increases metabolism. It does that by breaking down fat, helping to excrete the waste out of our body, and help to burn more calories. It also helps to reduce the risk of metabolic disorders. Metabolic disorders, again, are diabetes, high cholesterol, and hypertension. So this truly is science that you can find in the molecular and cellular biochemistry paper. This was another study that was done on rats. This is really interesting. What they did is they injected rats with 1.1 to 2.3 milligrams per pound of body weight. And what they found is that those rats who were given CBD had a significant reduction in body weight. And they also had a significant reduction in food intake. And it doesn't mean that CBD is going to make you not eat at all, but it's going to help reduce those cravings, reduce the intake of those bad carbs that you may always reach for. Another study that shows that CBD improves metabolism. How does it do that? It's through that endocannabinoid system. I'm telling you, it's just a great system that puts our body in balance. It puts our body in homeostasis. And our body needs to be in homeostasis because when you look at the pathology or pathogenesis of obesity and why it happens, again, you can see in this chart that it's reduction of that hormone leptin, which makes you feel full. Well, if it's a reduction in that, you're always feeling hungry. There's a reduction in or the insulin resistance is occurring. You've got inflammation, not only in the pancreas, but you've got the cells of the pancreas, the beta cells that are dysfunctioning. There's no homeostasis. There's no balance in these hormones that's going to improve our overall wellness and improve our weight. So this is, again, another important way that we can use CBD as a tool. Now, CBD is not magical. You heard from Dr. Crowford. You've got to get your adequate rest, 7 to 9 hours. Sleep is a direct correlation with your overall weight. You have to get in water, half your body weight, or a gallon of water every day. You've got to get active. You've got to do something. If it's a hula hoop, if it's kettlebells, if it's walking, it's got to be some form of regular exercise. You also have to find where you have the most success with your food. You don't want to have a diet that's so restrictive that you're always failing, right? And you don't want a diet that's full of Harold's chicken and Giordano's. You want a diet that many days you can be meat-free. Some days you have that plant-based diet going on, and then have in moderation red meat. We want you to stay away from red meat unless it's, that grass-fed beef. But the healthy lean protein, your veggies, your fruit, the fruit that's not high in sugar, like grapefruits and apples and blueberries and blackberries. You do want to stay away from bananas. They're high in calories. You should always consult your physician before you start any exercise plan or weight reduction plan. You always want to consult with your physician. So these are other considerations. I tell people all the time that taking CBD is not magical. You got to work with it. You can't expect CBD to turn that white fat into brown fat and you're still eating Harold's chicken, right? So let's move on to our products now. Enough of that. Our product line here at Wakanna is an amazing product line. We have so many products here that for those who are looking to reduce their weight, those who are looking to improve their sleep because they know they're not sleeping, those who are looking to improve anxiety or mood levels because they know that's a factor. We have products for everyone. But what you should know is that we can't make any claims. So we can't make claims that these products will, in 6 months, you'll be down 80 pounds, or that in 10 days, you're going to be down 5 pounds. These products should not be sold to persons under the age of 18. We do have vape cartridges and pre-rolls, and those products should not be sold to persons under the age of 21. And always pull your doctor in, consult with your physician, let them know that you want to use CBD for a lot of the things we talked about today to reduce inflammation, to assist with mood, anxiety, depression, to help to assist with sleeping disorders, and to help to assist you with weight loss as well. So our product line is very many ways that you can consume CBD. Let's start with our tinctures. Tinctures are an oil that's extracted from the plant, from the hemp species, and it's placed underneath your tongue. And it's important to hold the oil underneath your tongue for a minute before you swallow so that you can really absorb the CBD. Our tincture line, as well as our other products, come either in a power line. That's our full spectrum line. That's the legal limit of THC used in the power products, which is 0.3% or less. And then our pure line. That's our broad spectrum line. Those are products that contain less than 0.0% or less of THC. And the reason why the power and pure is there, because there's some people that have random drug screens at their job. So if you have random drug screens, you want to use the white label products, our pure products. And if you don't have random drug screens, you can use our black label or our power products. So we have our Hempranium 500 milligrams, We have our pure hempranium. We have our water soluble product. That's a product that you can actually put in water, juice, smoothies, beverages of any type. Again, starting low and slow. I always recommend you start with 3 drops in the morning and 3 drops in the evening, along with your exercise regimen, along with your diet regimen, along with your water and your sleep. You cannot forget any of that. And then our gummies, our edibles. Our flat belly coffee will, not on the website now, but many of you have tried it. It's amazing. It's a great tool that you can use in assisting with your weight loss. I've got people who like to put a scoop of the coffee in their smoothie. So there's different ways that you can consume it. But what I want to concentrate on now is the gummies in use for nighttime. We talked about adequate sleep. 7 to 9 hours of adequate sleep keeps those hormones, the ghrelin hormone and the leptin hormone, those hormones that make you feel full or those hormones that make you feel hungry, in balance, right? So you want to use our power gummy or our pure gummy about 30 to 60 minutes before you retire at night. This will allow that REM sleep, that restorative sleep, that sleep that when you wake up, you feel refreshed. These gummies will also address inflammation. We talked about CBD addressing inflammation. So as you're sleeping, it will reduce inflammation. It could be inflammation in your joints, or it can be inflammation in your bloodstream that is causing not only pain, but obesity. And then we have a product that you can bake or cook with. It's our culinary product. It's a great product that, let's say you want to, incorporate in your meals. You can bake and cook with our culinary product, the one up here. And then our bitters. Our bitter and our immune defense tea. Our bitter is a great way to detox. We understand that detoxification is an important part of weight loss, getting those toxins out of the liver so your body, your metabolism can function normally. We have a bitter tea for detox, a 4-day program. We also have an immune defense tea to help build the immune system up. Either one of those teas will be very good to implement along with these other products. And then our very new Delta 8 gummies. Now, this particular gummy is a product that if you have random drug screens, you cannot take this product. It potentially may show in your urine. Why? Because Delta 8 and Delta 9, they're like brother, sister, cousins, but they're so close together that potentially you may metabolize it in such a way that it may show up in your drug screen. So this particular gummy helps to improve your sleep if you're dealing with insomnia. It may help to improve your energy level. It may help to improve your sex level. I mean, we didn't talk about this, but sex is really important in losing weight. I think one sexual encounter, you can lose up to 200 to 300 calories on one sexual encounter. So having intercourse is a really important part of losing weight as well. This gummy also helps with creativity and relaxation, addressing inflammation. And then our topicals. Like I said, when you are on this weight loss journey and you've started to implement your workouts, you're sore. Quite honestly, I'm sore all the time. So I reach for these topicals to offer local relief to the sore shoulder, my knee, my lower back. I'm done with that heel spur, thank God. But our topical Power Extreme is a great product that you can use at night. Rub that on at night so that you can sleep along with that gummy. We also have Dr. Rita's Rub over here. It's in a liquid form that can offer pain relief locally. We have Power Body Mango Cream. More and more people are giving testimonies about this power cream, body cream, that's also assisting with reduction in inflammation and pain. So these topical products are a must. And then our smokable products. Smokable products work within 1 to 5 minutes. So when you are dealing with an acute situation, be it you want to get to sleep or inflammation or anxiety, All of these same conditions that factor in with weight loss are smokable products or something you want to use. Our vape cartridges, our pre-rolls, and our premium flour are our smokables. Our spices, again, our vegan butter. Our vegan butter is a great way that you can use if you're still eating oatmeal. We don't want you eating toast. If you're trying to lose weight, you got to throw the toast in the garbage. But you can put the butter in your oatmeal. You can put the butter on your veggies. You can put the butter on your grains that you're eating, right? And then the spices, our chili lime, our garlic fire, and our flavor king. These are great spices you can incorporate as well. And then essential oils are a key to weight loss. Why? Because essential oils are very soothing to the senses. You know, putting a lot of these essential oils in your diffuser helps to relax. The peppermint for me gives me energy. So before I work out, I take the peppermint and put it on the soles of my feet, because I know the soles of our feet have the largest pores, so I can absorb that all day with energy. So don't forget about our essential oils. So just to sum it up, 5 ways that CBD can help to assist you in your weight loss. It can help to burn more calories by converting white fat into brown fat, improving your metabolism. It may reduce inflammation of the pancreas, of blood vessels in the heart, inflammation in the joints. It's going to help improve the quality of your sleep by getting you that restorative sleep, that REM sleep. It helps to address stress and anxiety. That also plays a role in weight loss and reducing oxidative stress. You know, oxidative stress, by CBD being an antioxidant and having antioxidative properties, oxidative stress tears the body down. It wreaks havoc. So all of these 5 key components are really important to help us and to assist us in losing weight, along with diet, along with sleep, along with water intake, and along with exercise. So I'm going to take some questions. That's all for tonight. If you have questions, you can put it in the chat. We want you to contact the person who invited you so that you can get these products. You can get these products shipped directly to your home, so you can start using these products along with other lifestyle modifications that you're going to use to help you lose weight, to bring overall wellness, to improve your quality of life, and to improve and to reduce comorbidities like hypertension, like diabetes, like obesity and arthritis, and cancer. We didn't even talk about cancer and the ability to reduce your risk of cancer by keeping your weight down as well. So if there's questions, please put it in the chat. If not, we want you to contact the person that invited you so you can get your products ordered. So are there any tinctures that are flavored so they taste good? So our Hempranium 500 has a really nice peppermint flavor. It also has black seed and turmeric. It's a really nice flavor, our Hempranium 500 milligrams, Sue. So Sue, whoever invited you, you can get that order. It is a great taste. Is there a daily dose to take to support weight loss? You always want to start low and slow. There's no documented dosing to give to any specific person, because CBD and the dosing typically has many factors that we have to look at. We have to look at your body weight. We have to look at your body chemistry. We have to look at, you know, the severity of your condition. Is your BMI 30? Is it 40? Is it 25 or 20? So starting low with 3 drops twice a day is a great, great dose for you to start, to incorporate your workouts, to incorporate your diet. And you absolutely, in doing that, will start to see changes. Now, if you don't see changes in a month, you can increase that, right? You can increase that to 8 drops twice a day, with the gummy at night to help you sleep. So everyone is different, and it depends on a lot of different factors. Very good question. Are bananas okay? No, bananas are very, very high in sugar. So you should stay away from bananas, even though I love bananas. Yes, so hemp seeds are great for you. Hemp seeds are great nutritional seeds. They don't contain CBD. The actual seed doesn't. So when you go into the health food store and you say hemp seeds, or you add some hemp seeds to your smoothie, that's not the same as the CBD. So they're, very nutritious, and your omega-6, omega-3s, your proteins, your essential acids, amino acids, but don't contain CBD. But hemp seeds are very nutritious. How can CBD help someone that doesn't have a gallbladder? So someone who doesn't have a gallbladder, are they trying to lose weight? Is that what you're asking? What fruits are okay? I'm answering a lot of questions as I'm getting them. Grapefruits are great. Blueberries, blackberries are great. Apples are good. Oranges are good. And strawberries in moderations are good. You want to stay away from pineapple, grapes, bananas, watermelon. A lot of those fruits have a high glycemic index, very high in sugar. So fruits are okay in moderation, but if you're a diabetic, you really need to look at what fruit and how much you're eating.
Dr.
So
Rita, you have another question here.
Yes.
What's the benefit of using CBD in diabetics?
So CBD in diabetics, CBD is an antioxidant, it's an anti-inflammatory, and it helps to regulate and reduce blood sugar because it's reducing the inflammation of the cells in the pancreas that produce a hormone called insulin. So if you reduce the inflammation of the beta cells, you improve blood glucose levels by reduction of the inflammation. So we have another essential oil called black seed. I always pair black seed along with the CBD products, even though our Impranium 500 milligram product has black seed in it. I always recommend getting a bottle of black seed along with CBD if you're a diabetic. Black seed has been shown in research, years and years of research, to even rebuild the beta cells of the pancreas. So all your insulin resistant type 2 and even some of your type 1 diabetics, research has shown it's aiding in that insulin resistant patient. So black seed along with the CBD. Which gummies are the most potent for male enhancement? King of the Jungle. You want to get the King of the Jungle. Absolutely, for male enhancement. King of the Jungle. Yes. How do we use the flat belly gummies? Any particular time of day? I would use the flat belly gummies 30 minutes before meals. 30 minutes before meals. That's going to help reduce that appetite stimulation. I told my doctor I was using the CBD product, and she consulted a document that discussed interactions. All medications were okay that I take. Very good, Jewel. I'm glad to hear that your doctor took the time to do a drug-drug interaction and all of your medication is okay with the CBD. Fantastic. We have 2 minutes left before we close it out. Let me look at the Q&A section. I'm a guest. What's the benefit of using CBD? Oh, you got that one. You got that one. And not sure about the gallbladder question. If you can be more specific, that would be great. So what's a good product to start with if you're a diabetic? Well, it's important to find out what are your goals. So if your goals are to improve overall wellness, if your goals are to improve some of the symptoms that we see in diabetics, a good starting product is our tincture. Our 500 milligram tincture twice a day, 3 drops under the tongue twice a day. Also, you want to use the gummies at night to help you sleep. And you also want to start to use the topical relief for pain, because as you start working out, you want your workouts to be optimal. You want them to be optimal so that you can reduce local pain and discomfort. So those are good products to start out with. Well, wonderful. So it is time to go upstairs and deliver some COVID babies at this point. We are going to hand it back over to the person that invited you. Want you to give them a call. If you're a guest on the line, give them a call. If you're a business partner on the line, we want you to go to your website and really be serious about helping those that you know that really should lose weight or maybe want to lose weight, and really introduce them to some of the product line that we have here at Wakanna. Again, all of our products are organically grown, hemp organically grown. Our products are tested by third-party validation testing. Our products have certificate of analysis, and we also have such amazing Wakanna Advisory Medical Board that really brings on a lot of knowledge and power to you each and every Wednesday night. So be well, be safe. We'll talk to you next Wednesday with a new topic, but really be kind to yourself. You know, this is not a sprint, it's a marathon. Don't beat yourself up. We've all gained a little COVID weight. So let's get back on track. Let's get with our program. Let's get with our products, and let's get healthy. Let's get healthier, right? Good night. Thank you, everyone. Dr. Crawford, Dr. Erica Zachary, Dr. Rashonda Conti. Want to thank you guys for joining the panel. I want to thank all of our business owners and our guests. We want to thank you for tuning in, and we'll see you next week. Good night.